Good afternoon, good people. Guess what came out? The sun. Thank you for coming back to my channel. And I wanted to talk to everyone today about insurances for adults, preferably seniors. I think most of us are aware of Medicare, the traditional Medicare, the red, white, and blue Medicare. So with Medicare for your seniors, you have your Medicare Part A and you have Medicare Part B. Your Medicare Part A pays for hospitalizations. Typically, if you work for about 10 years, you've already paid into that system. There is no premium cost for you to have Medicare Part A. But there is a yearly deductible. And that deductible normally goes up, I'd say anywhere from maybe $10 to $15 a year. So in 2025, it will go up again. So then you have your Medicare Part B. Your Medicare Part B pays for physician's offices. Also will take care of your labs, your testing. There is a premium for that. So to my adult children out there that's trying to help your parents decide if Medicare is good, Medicare is probably the best. That's the traditional Medicare. Like I said, something that we've already paid into as the years have gone by and we've worked. You've paid into that. The second type of Medicare insurance for seniors is your Advantage plans or your Medicare HMO plans. With those plans, you do not have a deductible, but you will have a copay that you would have to pay whether you are going to a doctor's office or if you're going to the emergency room. There are several plans out there. So take time, sit down with your parents to see which plan is better for them. Is it the the traditional Medicare, or is an Advantage plan better for them? With the Advantage plan, it covers inpatient, when you go into the hospital. It covers physician's offices. You also may have a plan that will cover dental, and it may cover vision. When you have the Medicare HMO, what happens is you will be assigned a physician. There are particular physicians that will accept that Medicare HMO or Advantage plan, as opposed to the traditional Medicare plan where most doctors would take that insurance, but you still will have to call and see because a lot of things have changed over the years. With that Medicare Advantage plan, you will have a copay. You'll have a copay when it's time for you to go to see your physician, and they will expect you to pay that copay upon upon arrival to the doctor's office. You will have a copay as it relates to your visit to the dental office, and you will have a copay when it's time for you to go to get your eyes checked. Some HMO plans will also cover hearing aids, but then you would have to find a physician in your area that will take that Medicare HMO plan. So these are things that we would have to talk to our parents about, try to help them make the best decision for them. Now, with the Medicare red, white, and blue traditional plan, a lot of times our baby boomers, our parents, they probably retired from a company, and that company gave them a pension, and that company also allowed them to be assigned the company's insurance. If that's the case and your parents have retired, then that Medicare, traditional red, white, and blue Medicare would be primary, and then that plan that they have from where they retired, that would be secondary. And a lot of times that secondary insurance will take care of whatever is left over that Medicare did not pay. That secondary insurance will pay for that. When you have the Medicare HMO, it's just it pays like a commercial insurance plan. So whatever that HMO does not pay, you will be responsible for that. And most of the time, patients do not have a secondary that will cover, that will help them with the HMO plan. Okay. The third type of insurance that you will have may be a Medicaid. Medicaid is a state-run program as opposed to Medicare, which is a federal program. With the Medicaid is usually, there's a threshold, a limit as to how much you can actually make a year to qualify for Medicaid. Some patients have Medicare primary and a Medicaid secondary, but like stated, that depends on what's going on with them, what their income threshold is. A lot of times Medicaid is given for patients that are disabled. It's given for kids. Not saying that you can't apply for it, but if you make too much money, you won't get it because there's a threshold. Sometimes our parents may decide, I'm going back to work. So what happens when they go back to work is, if they sign up for that company's insurance, then guess what? That company's insurance will be primary and Medicare will be secondary because they are still working. Now, even if you never retired and you are 65 and you are with a company that has insurance and you have their insurance, that commercial insurance will still be primary and your Medicare will be secondary. So these are just things that we as Gen Xers need to know when it comes to our baby boomer parents and what we need to look for to help them decide which insurance is best for them. Also, with your Medicare Part A insurance, that insurance will pay for additional services. That insurance may pay for hospice, and typically it pays at 100%, or it may pay for home care, which there may be a 20% deductible. With hospice, those are for terminally ill patients in which the physician may say that there is nothing else that we can do for you, and let's just send them home and make them comfortable. Medicare will pay for that 100%. And with hospice, what we're trying to do is keep that patient comfortable at home, keep them out of the hospital, and just make sure they know what's going on. That is a decision that the family and the patient will have to make. Preferably, you guys have already discussed the wishes of your parents, so you won't have to make that decision by yourself. But things happen, and sometimes patients may go into, something may happen to them and they may need hospice, and you may have to make that decision. So that's why it's really important for you to sit down and talk to your parents to see what their wishes are. Some patients may not have any insurance, and due to the country that we live in, no hospital can turn you away at the emergency room if you don't have any insurance. So my suggestion would be, if that's the case, maybe find a neighborhood clinic that you can go to, as opposed to going to the hospital and using the hospital as using the ER as a physician's office. Maybe find a neighborhood clinic. So those are basically the type of insurances that our baby boomer parents may have. And like I said, it's really up to you to sit down with them and to try to go over which insurance plan you think is best for them. And just, go onto Medicare.gov. You can see the pros and the cons, the deductibles, why I choose one over the other, and that will help you try to simplify that process. And I know it's going to be hard. Hopefully your parents will listen. Hopefully they will make the right choice for them. I hope this helps in the insurance decision process. Hopefully your parents will let you help them decide which choice is best for them. And hopefully everybody will come out on top, okay? If you have any questions, please comment below. If you have any concerns, please comment below. Don't forget to like and don't forget to subscribe. Let me know, and we will see you next time. And hopefully the next time I come back, the sun will be shining again, because it just does something to your spirit when there's sunshine and not gray and darkness, okay? All right, everybody have a good day, and we'll talk soon.